for a BCG-unresponsive bladder cancer was really formulated by experts and adopted by the FDA, actually not for clinical use, but to facilitate single-arm registration trials and to encourage the investigation of novel agents in this space. And the term somehow over time became incorporated into clinical use and guidelines. And our question was, in real world settings, how do these patients actually respond to additional rechallenge with rescue BCG? Our study was a retrospective single institution study from January 2000 to September 2021, and we analyzed the outcomes of patients who had BCG-unresponsive disease as categorized by the FDA criteria, who received additional BCG. And at our institution, we had about 857 patients who received BCG. Of these, 172 were BCG-unresponsive, and about roughly 100 went on to receive a cystectomy. So of that very small number, we then had 36 patients who received additional BCG. And this was about 17 patients with CIS and 19 who had papillary disease. So what we wanted to look at in these patients, we wanted to mirror the results of clinical trials in this space. And we looked at high-grade disease-free survival and then duration of disease-free in those patients. And we also looked at cystectomy-free rates, progression-free survival, and overall survival. Of the 36 patients, after receiving rescue BCG, 27 or 75% showed no disease. Of those 75% who showed no disease, that response was very durable. The median duration was 83 months. These outcomes appear very favorable for these select patients. The disease-free survival at 12 months was 69%. The cystectomy-free rate at 12 months was 89%, and the progression-free rate was 86%. Overall survival was very high, 94% at 1 year and 94% at 1 year and 91% at 2 years. Because of the high success rate and the small sample size, we were unable to really identify any selection criteria that was associated with an improved response among those patients. But it's very important to say that these are select patients that were treated at our high volume center by bladder cancer specialized urologists, and they were very well selected. In general, we don't include patients who have disease worsening or lymphovascular invasion. We don't include patients who have hydronephrosis, variant histology, things like that. Those patients would not be offered rescue BCG. So this is a very select population of patients with selection bias. But to that point, I think in the single arm trials, there's also selection bias because it's not a randomized study, and those patients may not qualify for those trials either. We do need randomized clinical trials because there is clinical equipoise in this space. And in addition to that, we really need to understand the disease biology of the patients with BCG-unresponsive disease to really inform our clinical decisions and understand who is going to respond to BCG and who is not going to respond to BCG in a clinical way outside of the confines of a trial. BCG-unresponsive does portend a poor prognosis, but I think our study alludes to the fact that we need to have a better understanding of the disease biology.